Well, thank you very much for the opportunity to comment on the importance of the resolution that was approved by the WHO recently, very recently, on the issue of strengthening rehabilitation in health systems globally. This is an extremely important resolution. It is the first time that we have an official statement about the relevance of rehabilitation in today's health systems. And so the fact that it was supported by all countries represented at the World Health Assembly should convey that message to everybody. And I would encourage all of you to read the resolution because it is very clear what we're trying to accomplish. So to strengthen health systems, we need to include rehabilitation as an important service, as an important component of the system. And we need to be able to do that by strengthening different components of the system and of the process, like, for example, training a workforce that will be knowledgeable and able to deliver those services. Obviously, in the next few months, the next few years, the challenge is to implement the resolution. What are we going to do about it? How are we going to do this? And it may be clear to everybody that this may take different forms in different countries, depending on the local conditions. That is, of course, natural. But what we need is support at the level of the nations, support from the Ministry of Health, and the policymakers that need to understand why this is relevant, why this is important. There's a lot of people in the world in need of rehabilitation. The estimate that you have heard many times is 2.4 billion people in need of rehab who may benefit from rehab services. This is a huge number, and it is true in many countries of the world. This is not limited to a geography. So we need to ask ourselves, how do we make it a reality? How do we incorporate rehab into each of the components of the health systems that we may have in our own countries? And that is the challenge that we need to be working on. Thank you.